Getting a bone block arthroscopically to sit flush at the inferior glenoid isn't straightforward. It requires a more extensive soft tissue release than is often appreciated. Welcome to SportsMed Snapshots. I'm Noah Karabanow, an incoming medical student at Dalhousie University, and in this short video, I'll be showing you the medial-to-lateral subscap release during arthroscopic glenoid reconstruction. Adequate mobilization of the capsule, labrum, and particularly the subscapularis is essential to create a safe working corridor for graft placement. This video demonstrates the two key components of subscapularis mobilization, a superior release of the coracohumeral ligament and a deeper medial-to-lateral release along the anterior glenoid neck. This technique provides space for safe and accurate graft placement. This step shows the opening of the rotator interval. This step is essential as we cannot see the superior or anterior aspect of the subscap without opening the rotator interval. The key landmarks for safety are the CA ligament and conjoint tendon. To be able to get to the tissue safely from the front, the shoulder needs to be pulled posteriorly to be able to release the tissue safely. The coracohumeral ligament release begins on the medial side, staying close to the bone. At this point, the tendon itself is not being cut. Instead, tight tissue between the subscapularis and the front of the glenoid is gently released. Working close to bone provides better control and helps avoid unnecessary tension on surrounding structures. The deep release of the subscapularis proceeds from medial to lateral along the anterior glenoid neck. Electrocautery is first used to develop a subperiosteal plane directly on bone up to approximately the 6 o'clock position. A liberator knife is then used at around the 7 o'clock position to connect and complete this plane along the anterior-inferior glenoid rim. As the tissue is freed, the subscapularis becomes progressively mobile, improving exposure of the anterior glenoid. The release is considered adequate when the anterior glenoid neck is clearly exposed and the subscapularis can be gently mobilized out of the way using the switching stick. This creates sufficient space for the graft to sit flush against the glenoid surface. Thanks for watching.